this episode of Horse Shelter Heroes.
Dr. Gina and I are thrilled and honored to have our colleague, Dr. Yvonne Cheech, here today.
I'm like, hey, Angela, do I need anything from town? She's like, oh, you're going to town.
So we got the pig unloaded. It was relatively painless besides my eardrums.
Incredibly grateful that we've been able to say yes to up to 50 horses today.
We have a 15 to 20 cat rescue this morning.
We've rescued a lot of horses this month, more horses than we ever have before in 1 month through the buyout program.
So we had a hoarding case come in from the state of Georgia.
Today we are going to be concluding the horse training competition that we started over, I think about a month ago now.
You don't want to miss a single second of Horse Shelter Heroes.
Hi, I'm Marina, and I'm a veterinary radiologist who specializes in zoo and marine mammal diagnostic imaging. I'm a colleague of Dr. Lydia's, and I'm here today to help out a little bit with some of the patients at Horse Plus and introduce Dr. Lydia and Dr. Gina to some of their new ultrasound equipment they've recently acquired, which will help them with enhance their diagnostic capabilities basically for all of the animals here at Horse Plus. So I'm very excited to be here.
Dr. Gina and I are thrilled and honored to have our colleague, Dr. Yvonne Cheech, here today. She is doing me a huge personal favor by coming. You guys have heard Dr. Gina and I talk about needing a new ultrasound. We were able to raise the funds to purchase one from Edge Life Technologies. We looked at a ton of different ultrasounds. This one was far and away the leading one. And it's also one that Dr. Marina uses on marine mammals. So she is gonna help us image some patients today, but mostly she's training Dr. Gina and I how to perfect our settings so that we can get caught up with the massive backlog of animals that need ultrasound exams here at Horse Plus. So we're honored that she's here. I met Dr. Marina at my previous job looking at elephants. She was our radiology consultant for elephant imaging. So she's crazy overqualified to do equine stuff, but we're so thankful that she's here today. And Dr. Gina put together a whole list that I'm sure we won't get through, but we're gonna look at thorax, abdomen, distal limb, and reproductive tract today, hopefully, on at least one patient of each of those things.
Our first patient today is Sapphire. Yeah, this gorgeous little mare here. And we're gonna put a probe, I think, on some of her musculoskeletal structures and see what we can see going on in those hind limbs today. So this is ultrasound gel. Lots of things work in a pinch as ultrasound gel. You could use aloe if needed. I've been there. You got to be a little creative as a vet, right? But basically what that does is act as an acoustic coupling agent between the probe and the skin. It's 34 beats per minute there. You see that?
Spectre? Yeah.
Do you see? So that's just in between these
amazing.
3 contractions, and we'll save that little image there. Well, I mean, Sapphire was perfect. So her level of sedation that we had for that was excellent. She did great. She was motionless for us, which is amazing. And we were able to get really, really nice high quality images of her lung, which was normal as we expected. In her case, we were not expecting to see any pulmonary abnormalities. And we got some nice images of her heart as well. And I was just training Dr. Lydia and Dr. Gina a little bit on how to use the app that comes with this wireless handheld ultrasound. So it's an app that you can download, for any iPad or such tablet. And there's only a few basic settings that you need to know in order to kind of ultrasound right out of the box. People who are radiologists and cardiologists that use these kind of higher end pieces of equipment, yeah, there's a million different settings that you need to know how to adjust appropriately. But for the purpose of just scanning kind of right outside the box and trying to get a decent look at part of the horse's anatomy, I was just getting some of those basics done for them, and they immediately, of course, absorbed everything I was saying. And then Sapphire being such a good girl and having like a nice normal body condition, it was very easy to get high quality images on her, so that will help. And so I think as we get other horses coming in, we will look at different parts of the anatomy. We'll have Dr. Lydia scan some stuff, we'll have Dr. Gina scan some stuff, have them using the app and the iPad and getting used to how to adjust their settings to optimize their image quality, then we'll be good to go. Okay, so we just took a look at Glimmer, who is too handsome for his own good. That is his diagnosis. Diagnosis, beautiful. But aside from that, once we get past that part of it, we took a look at an area where we knew he had some pre-existing rib fractures, and we could see those really well with ultrasound, because what you can see with ultrasound is basically the surface of the rib, and it looks nice and smooth, and then all of a sudden it looks a little garbled and expanded and irregular, and then you can see so we basically kind of confirmed what we already knew, but I wanted to show Dr. Lydia and Dr. Gina what that looked like on ultrasound when you have a rib fracture or several. And then we looked at his lungs and did find some abnormalities there on both sides. And so some of the surface of the lung is a little bit irregular and invaginated, and there are some what are called foci of ring down, or areas where you have little kind of like beams or like little streaking things that come from the lung surface that shouldn't normally be there, that cluster a bit more than they should. And then incidentally, we were just looking at his belly, since we're right there, chest and abdomen. We're looking at some of his abdominal organs and got some nice views of his spleen and the liver on the left and his left kidney, and then noticed that there was a little bit of free fluid. What I would call peritoneal effusion, but a little bit of free fluid in the belly, kind of near that left kidney.
Yeah, Glimmer is a healthy boy. He's stable right now. None of these findings were like, oh my goodness, we need to operate on him at this moment. But we put him on our list because we've been a little concerned about him. He lost a lot of weight last winter. It wasn't his teeth or parasites, kind of the normal things didn't check out. So we also knew his lungs were abnormal. We did not know he had fluid by his kidney or any abnormalities in his GI tract, but clinically he's doing really well. So Dr. Gina and I will definitely investigate further, but thank you, Dr. Marina.
Oh, my pleasure. And I just wanted to add, based on what you just explained, that one of the challenges in radiology, or people who are experts in diagnostic imaging, medical imaging, right, in this case of animals, is that your job is just kind of to help the primary clinician or the clinical veterinarian figure out what's best for, like, how to best manage and take care of the animal. And so sometimes there are things that you find that don't fit with the clinical picture of the animal. So you might find, I don't know, something like pneumonia, but the animal seems very, very stable and doesn't have any blood work abnormalities. Or you might find something in the stomach that shouldn't be there, but the animal has not that a horse would vomit, but that a dog, for example, isn't vomiting. And so there's always a little bit of an effort to put those two things together. And when they don't fit, like if I see something in a medical imaging study that doesn't fit the clinical picture of the animal, the primary veterinarian, such as Dr. Lydia or Dr. Gina, they have to put that together and say, okay, does it make sense for me to explore these additional options? Or am I gonna say, like, no, I'm gonna treat the patient, not worry about that, note it, and say, okay, I'm gonna pay attention to that later, but I'm not gonna act on that because it's not in the animal's best interest, that kind of stuff.
We're so grateful this morning that we had Dr. Ivancic here with us at Horse Plus. She's a zoological radiologist, so her area of expertise is in animals with crazy anatomy, and she's super overqualified to be here teaching us about horses, but she was kind enough to come today. We looked at thorax, abdomen, cardiac, musculoskeletal, some distal limbs, some rectal. We didn't get to pregnancy checks, but of all of the things on our list, the one thing Dr. Gina and I feel more comfortable with ultrasound, it is pregnancy checks. So we have a ton of things on our list still, but we learned a tremendous amount this morning and had a really fun time doing it. So thank you so much for coming.
It is my pleasure. Thank you.
I had to go to town to get supplies for the education center, and I'm like, hey, Angela, do I need anything from town? She's like, oh, you're going to town. So she handed me the keys and a slip of paper that said we had some packages. Coming to find out, we had 67 packages. So Lynn and I are gonna go ahead and unload them, and they're gonna do package opening a few days early, and probably again on Thursday. So thank you guys so much. This is absolutely awesome. Like you said, it was feels like Christmas in July.
So Chandra and I just went to Nunnally, Tennessee. It's out by Centerville to pick up a pig. And while we were there, the owners of the pig, the old owners, had a lot of stuff they wanted to donate to us just for picking the pig up. So we got a lot of stuff for the education center. We got some light fixtures, lamps, we got a fridge, and we got a microwave. And I'm gonna go ahead and unload this pig now. Yeah, the old owner gave them to us to give them to her. I guess it's one of her favorite treats. So we got the pig unloaded. It was relatively painless besides my eardrums. And she's good to go. We're gonna leave her alone and put the trailer up.
So we went to Nunnally today to go pick up a potbelly pig named Daisy May. And while we were there today, the owners are in the process of relocating. They had some really great items they decided to go ahead and donate to Plus Humane Society for us to use here, such as a stainless steel refrigerator, a stainless steel microwave, table and some chairs for the employees, or when we're doing trainings and things for all the people coming in for education programming.
We're about to open packages. We have over 50 packages. I heard 67. I haven't really counted them, from our amazing supporters who were so excited about Amazon Prime Days. So, wow, how amazing is this? We had 3 package openings last week, and now we have all these packages today and more on the way, actually. Jordan and Emily are just showing up with more.
Quacker's prosthetics came in, and we are so excited to unbox this. Thank you to our Etsy seller. Ooh, he's gonna be stylish. They're so funny.
Does it flex when he walks?
Mm-hmm.
So he gets 2 of them? And it's got little
Yeah, supposedly one's for his normal foot and one's for his not normal foot, so they're even.
That is nice. Oh. It's got neon green shoes.
I'm jealous. This guy is going to be so stylish. You know, that would be a really fun feature if they did. They look kind of sparkly. He's going to be glamming. It's a good color. The owners will be coming Thursday with Quackers to do a little test try on and see how he reacts to this extra support. And we are so excited, and we really are very hopeful that there will be a good reaction to this. And yeah, there's some
It has
ties.
holes for laces.
Yeah. Be laced up. We're so excited.
And we are going to start opening packages.
It is our buyout rescue mission. We have been fundraising, and we're so incredibly grateful that we've been able to say yes to up to 50 horses today. We'll see how many trucks and trailers actually come. There's a big auction here in Tennessee tonight, so we're working on intercepting as many horses as we can. Pretty busy schedule for us today, but as soon as the horses get here, we're going to be all hands on deck on the horse department side of it. So yeah, let's get ready to do this. It's gonna be a great day.
So it is buyout morning. We are getting everything together and put into vehicles to drive up to quarantine, and it's also raining, as you can see. We have 20 plus horses, maybe more, coming in, so we're anxious to get them in and make sure everybody who's critical is taken care of.
We have horses down at the main office, and they're getting checked in down there, make sure their health certificates and Coggins and all that is good, and then they'll be up here. So our medical team is just getting here, and we're gonna be all set up and start doing our triage intake. So it'll be exciting to start helping horses. First trailer got here. Apparently there's 16 horses on there. There's supposed to be 20, but he didn't want to overload his trailer. And there's, I think, 5 draft horses on here. So he's definitely got a lot going on. I can't wait to get them unloaded. I know there's a draft horse with a pretty bad leg from what I've seen with photos. When these trailers come, it's like complete triage. This horse's back leg is not able to put weight on it. It seems very painful. Vets are with the 2 draft horses that are the most critical there. We've got a lot of critical horses here. Horses like these and these draft horses here, they ship them to slaughter in this condition. There's no oversight to being like, this animal is suffering. It's like, send them to slaughter. And that's why we do what we do. They're getting pain meds on those horses. And I know as soon as they can, they'll look at this guy. He is blind. He's a standard bred, so we should be able to find out who he was. But he's definitely got a very, very bad injury on his back end. He's very painful.
That was flunixin meglumine. It's a non-steroidal anti-inflammatory. And did you see the head shaking? A lot of horses that have had a lot of IV medications that are reactive to pokes will shake their head like that. So I unattached the needle for that reason. Poor mare has a lot of problems. She's got bilaterally blind, very painful eyes. She looks like she's got a pelvic or femoral fracture on the right hind leg, and then her left hind leg is also very swollen. She has had IV pain medication, but you can see, if you look at her hind leg, see how severe the atrophy is right there? So she's got very severe lamenesses in both of her hind legs. I didn't get an age on her, Tani. Did somebody age her? Okay, so she's in her 20s and she's very painful, and she would be facing surgery on both eyes, irregardless of those hind legs. So I'm recommending Last Act of Kindness, and I think she's very, very painful. We've made her a priority, and we're gonna go ahead and do that now so she doesn't suffer. We pulled these 2 geldings out. They both seem to be very painful. I haven't gotten accurate heart rates yet. I'd like to give it just a quick second once they get off the trailer, so that's not a false elevation. This horse is non-weight bearing lame on this left front. He's got a deep puncture wound on the front of his leg and also on the side, and it's very, very hot and swollen. And I'm gonna stop right now and go get them pain meds, and I'll keep talking about it in a second. This horse's leg is horrific, clearly was broken a long time ago. Now it's 48, so 48 is still elevated. We still have pain and a ton of effusion back here, but that's a really nice response. That's what we're looking for. This horse didn't just get Banamine, he also got Dormosidane. I would really like radiographs of this leg, but I don't think that we're gonna be able to fix it. So I wanna make sure it's fair to him, that he's comfortable enough that we can take an x-ray. Do you guys see this? That's all effusion in the tendon sheath right here. He's 12. I think that injury it's definitely over a year old. And I say that because, can you see the severity of the muscle wasting right here? Like, this is one of the pectoral muscles. This one is also very weak, but look right here. I mean, there's not even a muscle there. And then it takes a lot of time. Wolff's Law, bones remodel in response to the forces put on them. So this is all bony right here. We're gonna radiograph it, but that much of a bony callus formation takes a ton of time.
That big, beautiful draft boy that was only 12 that we're talking about having a carpal and a ulnar fracture or distal humeral fracture. This is his carpus, or his, what everyone calls the knee, but it's really his wrist of his front leg. If you look at all this, it shows a lot of reaction remodeling. There's a lot of like that moth-eaten appearance that we were talking about before. And then this is it on the lateral. If you see that, it's not supposed to cave in like that and have all that out there or back there. And then we go up. All of this right here and stuff is abnormal. This is his elbow.
Okay.
There's another view of his elbow. So, yeah. So unfortunately he has fractures in 2 places on the same limb. So that's really hard for especially a big draft horse to recover from. If he was a smaller, leaner type of like mini horse or a hackney pony or something like that, and he was well adjusted, a prosthetic could definitely be something in his future, but he's just so big it would be very hard for him to get up and down and move around. So fortunately, the Last Act of Kindness is the best thing we can do for him at this point.
All
All right, so this beautiful boy, I think he's about 13 years old or so. He's got a wound at his fetlock and down around his, right above his coronary band on his left front. And so we took some radiographs and you can see he's got some soft tissue damage there and he's got a little bit of bony reaction here. So the wound probably at one time might have communicated with the joint. I don't see really a deep gas tract or anything, but that remodeling shows damage. And then there's a little bit more down here, some there, and more down in here. So there's his DP, and you can see some small remodeling there, but mostly down here. And so we focus more at the second wound that's lower down. And there's lots and lots of, some of this is artifact, but that stuff on the side bones and up here is not. So he's got lots of remodeling. He's very painful. So more likely osteomyelitis infection. So I haven't heard the conversation with Dr. Lydia and Tawny about him. So I'm not sure what their decision, the final decision is on him, but this, seeing as how he's so painful and these reactions, I would think he would be suffering more than we could control. So I think the last act of kindness is what they have decided, but I haven't heard it directly from them. Our osteomyelitis is infection of the bone. So all that reaction remodeling that we saw, when you see that kind of reaction, it's most likely osteomyelitis or an infection around the bone, as opposed to like a tumor or a type of bone necrosis or something like that.
This gelding has very severe swelling of his sheath. I am sedating him so I can do a thorough hands-on exam and try to see if we can learn more about what's going on there. So excited, we have our new ultrasound here at intake day today. This lovely gelding has a very swollen sheath, and if he's able to urinate, we have time to do more diagnostics and see if we can fix the problem. If he is not able to urinate, he will have a very large bladder and will likely be very uncomfortable because of that, and it will help us have more information. So I am using the rectal probe on our new ultrasound, and look, it just fits in my pocket and talks to its little iPad friend. So I'm able to do this and stay nice and clean even in this environment. Males tend to be a bit sketchier with rectal palpation than females.
Can you see okay?
Oh my goodness.
Maybe.
Can I ever? Look, see the blood flowing through this vessel? That's blood flow. That's a vertebral body. I mean, I can see everything with this thing. What we needed to know was, is this patient able to urinate? And I think based on the gross appearance of his bladder, he likely is able to urinate. Let's throw a probe on his prepuce itself.
So we are planning to run a CBC chem on him to see if he has any alarming blood abnormalities that we have to worry about. Otherwise, he does have a dropped beat, whether that's primary, secondary, AV block, we don't know off the bat. So we can do some exercises with him and see if it improves or persists. And then his sheath is really swollen. So I'm not sure if we're gonna try and sugar pack it or what to try and reduce the swelling, but we need to find the root cause of his swelling. So he's getting his rabies 5-way, strangles, Quest Plus, which is a dewormer, his microchip, and we're gonna put him out in the pasture and let him have time to decompress while we run our diagnostics.
Strangles done?
So we are stopping for lunch in between horses. I think we got through, what, like 9-ish horses? So we still have the rest that came to get through. And I think we have another trailer coming this afternoon, so we'll be busy when we get back.
We are asked to help hundreds of animals every single year. We cannot do that without your support. Being on the front lines of animal rescue, we see things that break our hearts. It's through donations that we're able to say yes to not only horses, but dogs and cats as well. Every animal deserves a second chance. At Plus Humane Society, the plus in our name is for every other animal besides horses that needs help.
and we help thousands and thousands of animals. But we can only do that through support from people just like yourself, donating to help us help the helpless. If we don't have support, we cannot save these animals. Please make a donation right now and be the difference for an animal in need.
So we had Dr. Marina come in yesterday to help out Dr. Lydia and Dr. Gina with the new ultrasound machine, and she fell in love with Salem, and so now she's coming back today to adopt him. We are just so excited that he's being adopted by her. We know that he's in good hands. He's had some problems, and we know that she will take good care of him.
So this is little Sushi now, and we found this beautiful little kitten here at Horse Plus, and he's kind of just buttery and scrumptious and does nothing but purr constantly. So we fell in love, and we're gonna take him home to Illinois and give him a wonderful life for the next 20 years. My experience here, so I got to work here a bit with Dr. Lydia and Dr. Gina yesterday, looking at some horses and doing some ultrasound, some diagnostic imaging, which was every bit as fun as I thought it would be. And the veterinarians and the staff and the animals actually were all lovely. So it was, they thanked me for coming to help, but it was definitely my treat. What do you think, Natalia?
Good.
You think it's good? Oh.
He smells so good.
He smells so good. That's my daughter, Natalia. So we're thrilled to have been here for a few days and have this experience, and now we get to take this little love with us. So it's a win all around.
Thank you. It was nice to meet you. Thank you very much.
Yeah. Thank you.
Yeah.
Thank you. Come here, little bunny.
Bye. Take care, guys.
So Dr. Marina and her family just left with Salem, and we are so happy that he found a home. He's been here for a little bit, and now he gets to go and spend his life with his new family.
We are back from lunch and about to get really busy. We have 16 horses today, and then over lunch we found out that the other horses are coming in tomorrow. So that definitely changes things today. We can go a little bit slower paced. And tomorrow we'll have 30 horses coming in. So tomorrow will actually be the biggest buyout.
This gelding is about 22. His left eye looks like it ruptured at some point, probably in the last year, so he needs surgical removal of the rest of that eye. He does have elevated lung sounds on both sides, and he's got pretty severe mucopurulent nasal discharge. Tiny bit of lymph node enlargement up here, which is not great, but because of how his lungs sound, he's more likely a candidate for pneumonia, and his age, for pneumonia than he is for strangles. We're gonna give him a broad spectrum shot of antibiotics, and I would love to put him down for a full thoracic ultrasound and enucleation, maybe tomorrow morning. We did it first thing tomorrow, but he's gonna need to be quarantined from other horses because of his nasal discharge situation.
So this horse right here is done. We gave it all the vaccines that it needed. We did not give it strangles, however, because it does have nasal discharge on both sides and swollen lymph nodes. It is going to need a eye enucleation, and we're gonna try to get that done tomorrow morning. So we're gonna go ahead and put him straight onto a trailer and bring him straight down and put him in the stall in the vet barn.
This is our 15-year-old Tennessee walking horse mare. So Dr. Lydia and I are going to use our new ultrasound system to check out her lungs and her reproductive system, because she has significant respiratory noises on auscultation with our our stethoscopes. And because she's a 15-year-old mare, Dr. Lydia just wants to make sure she's not pregnant. So I think we're gonna start with looking at her lungs first, and then we'll switch probes and do the preg check.
This little mare in here is about 15 years old. She had some elevated lung sounds. Dr. Gina was able to do a thoracic ultrasound and document some abnormalities on the surface of that lung. I also did a pregnancy check on her. She did not appreciate rectal palpation, which is understandable. Even with sedation, we had to put her in the squeeze chute, and we had a pretty limited time because she kept trying to sit down. But based on my brief scan with our beautiful new ultrasound equipment, I was able to see that her left ovary had some follicular activity, so I think that she's actively cycling, and I didn't see or feel any positive signs of pregnancy. So we are going to let this mare decompress. She's very thin. She needs to gain some weight. She needs a dental, and she got some vaccines today and a microchip, and we're gonna turn her out in a pasture and let her decompress before we do more with her.
We're wrapping up today, and I want to give a huge shout out to the donor who donated the ultrasound. You know who you are. You came here for a visit and you saw firsthand why we needed an ultrasound. So this was the first time we were able to use it during an intake. So how was that?
I mean, I don't even have words for how incredible it was. We always do the best we can with what we have in shelter medicine, but number one, my mind is blown by the incredible quality of the image that we got.
And this is a handheld.
It's so tiny. It's so tiny. So this is 3 of the 4 probes. Don't let it deceive you. This is a very expensive piece of diagnostic equipment, but it's incredibly user-friendly. The image quality is amazing. Like, it's better than the giant industrial ultrasound that I used when I was at UGA. So
yeah.
We had at least 4 patients today that we wouldn't have had a solid answer and we would have had to guess. And because we had the ultrasound, we didn't have to guess, which is incredible. It's so much more fair to our patients when we have those. So the ultrasound is just tremendously helpful. And unlike a lot of the equipment we use is kind of good for one thing. The x-ray equipment and the ultrasound do so many jobs. X-ray can only evaluate bones. The ultrasound can evaluate any soft tissue. So gastrointestinal, thoracic, musculoskeletal, all of these body systems we suddenly can image. It's a big learning curve.
And we saw like the heart beating, and then
Yes.
like we stop and not be beating, and then like in the intestines, all the movement within there,
Yes.
like it's incredible. So we're just wrapping up today. We thought today was gonna be our busiest day, but tomorrow actually ends up being our busiest day. So we were able to take it a little bit slower and do the best for each and every horse. And we will be doing a debriefing. So I know you all have a lot of questions about the whole buyout and like, what happens to all the different horses and what's going on with that horse. You'll want to watch our debrief that will be on YouTube, and that will go over in greater detail. So one thing I did find out today is we did have a donor that was going to fund the quarantine expansion project. She's realized that she can't fund the complete project. She is going to be putting up a matching donation of $50,000, and she's hoping that the rest of you, she's already put a lot of money into this expansion project, and now she's saying, look, I can do 50 more thousand, but I will do it as a match and ask your donors to help with the quarantine expansion. So we don't want to be freezing this winter. So watch for a fundraiser for the quarantine expansion project. With the buyout program, we are rescuing more horses than we ever have before, intercepting them from slaughter. And we have to have a better intake facility to do this job. So be watching for that fundraiser. And again, thank you so much for all of your support.
We have a 15 to 20 cat rescue this morning that we have to go take care of. So it's a busy day. We have 15 more horses on the way, and just dealing with all the things, normal everyday things that we always have to deal with. So we're just going to take a deep breath, and we are going to get through it because that's what our team does. So we are here rescuing 15 to 20 cats. So we've got the clear go-ahead. Sheriff's Department's with us. We have the go-ahead from the owner to enter the property to get the cats. So that's what we're gonna go do.
So far we are here at the residence, and so far we have managed to capture 9 cats. So we are looking for one currently in the basement that is rather feral, and we are still on the hunt for the remaining cats.
So we have just completed the picking up of the cats. So far we've got 11 of them, and the neighbor will revisit the residence in the morning to see if there's any more cats to be picked up. We've got the trap set in the basement, and we will see if there's a cat there in the morning. And so far we'll take these cats back, get them assessed by our veterinarians, and get them into some rescues. We just got back from our getting cats. So we have 11 here on the property now. They'll be all being intaked, seen by our veterinary staff and intake team. And as for the trap we set, we have someone that is checking the trap tonight and tomorrow, and we will be going from there.
So we've got most of the horses run out. There's still one horse out here that we're trying to find, or at least I'm trying to find right now. I'm up here by myself. I don't have service up here. There's never any service back here in quarantine. I did bring the sat phone with me though.
That's right. If you go to sat123.com Horse Plus and get one of these life-saving devices, Horse Plus will earn a commission, which will help us save more horses.
So we can call somebody out here to help me out.
This amazing satellite phone, with its small yet powerful form factor, delivers trusted, rugged, reliable communications all in an easy-to-use handset.
All right, you coming up? All right, thanks. Bye. So this thing really does come in handy, especially in rural Tennessee. There's just some places that do not have service. It's made by Iridium, and you can get yours today by going to sat123.com.
If you go to sat123.com Horse Plus and get one of these life-saving devices, Horse Plus will earn a commission, which will help us save more horses.
It is bright and early here on, is it Wednesday?
It is
Wednesday morning here at Horse Plus. We have another 30 horses coming in today. We took 16 in yesterday. We took a lot in yesterday. One of the horses we took in yesterday is systemically stable but has a very, very painful eye. So we're squeezing in an enucleation for him early this morning. Can you guys hear over the barking dogs? Okay. Here he is. Unfortunately, he doesn't have a name yet. He's B24345. Good boy. You can see he's got pretty severe bucopurulent nasal discharge. So Dr. Gina is going to be performing a thoracic ultrasound to look at his heart and lungs while I remove his left eye today. And we're hoping to be done pretty quickly because we have horses coming in at 9. And Mari, you can just move this until we have him sedated. So that is what we are doing this morning. And we're going to do it standing. We've had really good success with standing enucleations before. He's going to be sedated. Hi. He's going to be sedated and then also have the whole eye area blocked so he won't be able to feel. This poor gelding had his eye rupture, it looks like. So when the cornea ruptures completely, the whole contents of the anterior chamber and sometimes the posterior chamber come through the eye. It's extremely painful. And now he has entropion where his lids are folding in and rubbing on what's left of that eye. So we couldn't wait on the surgery even until next week. He's really painful with that eye and we're gonna get it taken care of. He had a broad spectrum antibiotic injection yesterday, so he already has antimicrobials on board and his blood work shows that he's well hydrated and a good anesthetic candidate this morning. I'm doing a combination of 50-50 lidocaine and bupivacaine. Both of them are topical numbing agents. Lidocaine starts working very, very quickly, within a couple minutes, but it only lasts for 30 seconds. Lidocaine only lasts for 30 minutes. Bupivacaine takes about 30 minutes to start working, but then it lasts for 5 or 6 hours. So when we combine those two, we get rapid numbing and a long time of numbing. So I'm doing just a basic ring block around these lids. That's the first step of our surgery, is gonna be to suture these two lid margins closed, and then I'm gonna use that as the little purse string for the tiny bag that contains the eyeball.
I'm going to attempt to use our new ultrasound to look at his lungs and heart primarily, but I might scan and look at his other organs if I have time, if she's not needing him out of here by then. You are so fat, I can't see anything.
Went great. I'm just gonna get some clean tools ready and a new pair of sterile gloves, and we'll get it closed. But it went perfectly, and I think he's gonna do great in recovery. We're all finished with his surgery. I'm gonna clean the blood off his face, and we'll get him fly sprayed. We're gonna give him some IV pain meds, and then we'll take him back to our recovery stall. If you would like to watch this enucleation surgery in detail, please go to our other channel, Horse Plus Vets, on YouTube. This is just our same kind of zinc oxide base wound cream. Mostly I'm putting this on here because I'm not gonna wrap his face, and I wanna make sure we have a really nice, clean agent that will keep it moist. He is going to be in our vet hospital, which is a building, but obviously we do have flies come into our building, so we wanna make sure that he doesn't have flies bothering that surgery site.
We had more horses coming in today, and the first trailer actually showed up while Dr. Lydia was in the middle of her enucleation, so we are getting everything together to go up there. Corey and Tawny were up there to initially watch the horses get off the trailer and make sure there were no emergent cases, and everybody seems to be okay and stable, so we're gonna go up and intake them.
We've rescued a lot of horses this month through the buyout program, more horses than we ever have before in 1 month through the buyout program. So we're very, very busy. Thankfully, the major part of the storm has gone past and it's not raining like it was. So we're very grateful for that. But time to get busy and get these horses intake done.
Her heart rate is 58, upper end of normal is upper 30s. And we'll check that heart rate again in a couple minutes and see if it's come down with those pain meds. They probably haven't kicked in yet.
Yeah, pretty severely. At this point, it's so advanced, there's nothing we can do to reduce that.
Big granulomatous lesion on the back of his right hind leg, and you can see how thick that leg is. Looks like he may have gotten caught in wire or rope or something that encircled that leg. There's a lot of thickened tissue. Thankfully, there's no bony component, so the leg isn't broken, the joints look okay. We are definitely gonna use our new ultrasound to image the suspensory apparatus, but I'd love to do it on a fully clipped, clean, immobilized leg. So if we're gonna operate on him anyway, we're gonna pair that ultrasound exam with our surgery day. His heart rate was normal. He doesn't seem to be too lame on that leg. So I cleared him to get some vaccines and a microchip today, and we're gonna turn him out and schedule his surgery probably for next week.
There you go, bud.
She is on with the support to see if she can get the rectal probe to work. If the rectal probe will not connect in a timely enough manner to her sedation, she's just gonna go out in Q1 and then we'll have to preg check her later.
We got it figured out. We are in business. And hopefully this young mare does not kick me or hurt herself. And we can find out whether or not she is pregnant. I did not see any positive indicators of pregnancy trans-abdominally, but this is going to be kind of the more definitive look. You guys see that? So here's amniotic sac. There's fetal heartbeat. Look, you see it? That's crazy. You guys see that? So amniotic sac. This is our fetus, and we see fetal heartbeat right in there.
She's early pregnant.
Let's see.
Hold on. Yes, let's get a photo of that baby.
Yay! See the fetal heartbeat?
Yeah.
You guys, how incredible is this ultrasound?
Okay.
We don't know how to use all the fancy settings yet, so we're gonna learn, but she's definitely pregnant.
I came from the back.
Haley, I saved the clips. We had some user error technical difficulties getting the rectal probe connected. So we had to call Edge Life. They were wonderful and fixed the problem almost immediately. And this lovely little 5-year-old mare is definitely pregnant. We got to see the foal in there, and we got to see fetal heartbeat, even though she's pretty early pregnant. So that was really exciting for all of us to see. We love our new ultrasound. I would never have been able to feel or see that pregnancy with our old ultrasound. So again, life-changing new diagnostics makes our job really exciting.
This beautiful gelding is about 6 years old. He's got some brands on him, so he was used for bucking stock. He's really, really nervous, but he's really beautiful. I didn't hear anything on auscultation. He didn't really like me listening to him very well. He tried to kick me when I was on the right side, but we're gonna try and give him some time to decompress, and we're probably gonna give him all the things today, like his microchip, his rabies 5-way, and strangles if he doesn't have a temperature.
So the black and white paint mare was extremely traumatized, and this horse we believe is a bucking horse is really hard to catch. So we're just gonna let them hang out together because we know we have to run them in to catch them anyway. So we're really hoping that the black and white horse will be able to decompress and be okay. She's suffering from a lot of mental trauma, and that's really hard for her. So we'll hopefully, given some time and just enjoying the pasture and just being a horse, she'll be okay, but we don't know.
I'm not sure who contributed to our pizza lunch today, but thank you so much. It's been a really busy morning, a more optimistic morning than yesterday. We had a lot more horses come in today that I think we're gonna be able to fix, but we were all very, very hungry. It's been raining all morning. We're all really soggy and muddy. And instead of walking all the way back down to our office to get our lunches, we were able to just do it here. So it was delicious. This is my 4th piece. Thank you, whoever brought it to us. It is awesome and really makes a big difference when we can just quickly eat and keep working on horses. This cute little mare had a pretty big, not that big, maybe a 1-inch laceration above her left eye that was full skin thickness, and she's got a lot of associated swelling. It looked like it had only happened maybe 3 or 4 days ago, so I was able to block the area with lidocaine and put some sutures in. I don't know how many sutures she ended up getting. 6? Took 6 simple interrupted sutures to sew that shut. I think she's gonna be fine to still be out in pasture, but she looks great. She was a very good patient, and she is finished. And actually, before we put her back, let's just do her things real quick. Let's microchip her and give her vaccines. This sweet little gelding is about 23, 24 years old. He's completely blind in both eyes. Probably will need to have both eyes removed if he is able to gain weight. So we're gonna run blood work on him. We're gonna sedate him and take a really close look at his teeth. And if systemically he passes both of those things, then we'll schedule him probably for a bilateral enucleation. It's important to note that he already can't see at all out of either eye. So a blind, non-painful eye, we don't have to remove. A blind, painful eye, we always want to remove. And he's a very, very sweet boy. He startles a teeny tiny bit when you first come up to him, but then once he knows you're there, he's totally fine with you being there.
We have wrapped up with the load of horses that came this morning. There's supposed to be another trailer coming. We don't know. We've been reaching out to them, and so far it's been silent on their end. But since we've got everyone wrapped up, we're gonna go ahead and break down our station, and then we can easily bring it back up here as soon as we get information whether or not they're coming. So how did it go today?
I think it went well. We have a lot of horses that were actually in great body condition scores that need to decompress and then reevaluate. And then Dr. Lydia found one that was pregnant with her new ultrasound.
Yes. So exciting, so exciting.
Yeah, I think most buyout days, the really heartbreaking cases outweigh the success stories, and today felt like that ratio flopped a little bit. We still did have to make some hard calls, but those hard calls are a lot easier when they're animals that are really suffering. So that part is always tough, but yeah, our new diagnostic equipment is like, it's like Christmas and our birthdays all in one. So that is really fun.
So is that the first time you get to see a baby?
Yes.
In an ultrasound to that clarity?
Yes. Well, I mean, in the last 10 years at least, right? Like I've observed, but as a clinician, I've never had access to an ultrasound this good.
So exciting. So, all right, well, thank you so much for your support. We will be doing a debriefing at some point here as soon as we get everything squared away. So do stay tuned for that. It'll be on our YouTube channel, and we'll go over each and every horse and what went on with those horses. So, all right, thank you guys so much.
And thanks for the pizza.
Yes, the pizza.
Our volunteer days will take place the first Wednesday of every month from 9 to noon, weather permitting. We will be doing projects like painting and cleaning and other things that will be pretty messy, so make sure you wear clothes that you don't mind getting dirty. At some point in the day, during our volunteer time, you will also get to spend a little time with our mascots Dino and Cowboy. If you want to come and spend a little time at our facility, we highly encourage you to come out to our volunteer day, and we look forward to seeing you.
Good morning, everybody. So we have something fun to do this morning. We have Christmas in July. One of our awesome donors has Dee Dee, is what she goes by, has donated a bunch of fun little white elephant Christmas gifts for us. So I don't know what we're all going to get this morning. It's in a box over here. I'll need, Troy, can you get the box over there for us? And also the little box there for us. And we'll pass these out for everybody this morning, and I don't know what we're going to be getting. And if you want to trade later on, you're welcome to trade your white elephant gift. But these are from a wonderful donor. Here. It says, "Thank you all for everything you do. I know you guys work way hard day and night. We had to put down our Smokey, 32 years, and then Bucky Boy, 31, about 4 years later. Both beautiful buckskins. So, Merry Christmas in July. We wanted you all to take a minute and sit back, chill, and have a laugh or two. May God bless each and every one of y'all and all the animals. Your friends, Dee Dee and her husband. Our old doggies, Gracie, Lou, Cat, Jeffy, and Newbert. Chickens, Speckled Butt, Cheeks, Red, and Nellie. There's a new name for a chicken, John.
Nice.
And that's from our donor. And
Thank
the
you.
beautiful horsey card.
It's so sweet of you. Thank you so much.
Okay. Which one do you want, Keith?
No.
Corey. It's a really pretty sunshine. Oh,
Nice. Almost like you're going to a very cold place.
I am going to freeze in these.
Cute ducky.
I have my plant hanger, which is awesome because if you've been to my house, I have like 55 house plants.
Look out there, Angel.
Oh my gosh, that's what I need. Seriously, for my boots. Oh, nice.
Nice socks. Thank you so much for your Christmas in July donation. I mean, it really meant a lot to us. I mean, Christmas in July. Who doesn't love Christmas in July?
So we had a hoarding case come in from the state of Georgia, and they are bringing the animals all in up here to Horse Plus Humane Society. So we are intaking the animals at this time, where they'll be evaluated by our veterinary staff and intake team medical team, and we will get them all moved and taken care of.
Hi, I'm Audrey, the founder of Lux Rescue, and I'm here today at Horse Plus Humane Society. I brought in a hoarding case. Horse Plus Humane Society was so gracious to take my call for help when I reached out to them about this hoarding case. We live in a very rural area of Northwest Georgia where we don't have an animal shelter, we don't have animal control. And Lux Rescue is just a small grassroots rescue that's foster based. And so when I came across this hoarding case with puppies dying, puppies covered in fleas and ticks and throwing up worms and even having trauma wounds on them, and the cats as well. We counted 40 plus animals the first day I was out there, and as you can imagine, I was very overwhelmed. So I reached out to Horse Plus Humane Society, and they came to help. And this morning we picked up all the animals on the property and we drove them 3 hours away. And now we are busy at work intaking all of the animals and getting them all of the medicine that they need to get onto a healthier path.
We thankfully had a day heads up on this, but today we took in, don't actually know how many animals, potentially 25-ish dogs and 12 to 15-ish cats. We haven't processed all the animals yet, so we're not sure of the exact numbers, but these animals came from a hoarding situation in Georgia. Vet team is kind of staying on the sidelines and triaging the more medically needy cases. So unfortunately, we had one puppy arrive in status epilepticus, which means he was actively having a seizure. I was able to give him some midazolam, which is a benzodiazepine. It's a medication that stops seizure activity. So thankfully, he responded very quickly to that. And we gave him some fluids, treated him for fleas. He is covered in fleas. I mean, like so many fleas. And also gave him a little bit of some Caro syrup, which is just basically corn syrup, but I suspect that his blood sugar was so low that it triggered seizure activity. So he's doing much better. That's him whining. He really wants to eat more, but we're watching him really closely. You have to be careful with that. And then another puppy is in very, very severely bad shape. Actually, we have a bunch of puppies that I think are only like 4 or 5 weeks old that don't have moms. And the people who brought them here said that a lot of other puppies had died last week before they got these animals. So we're trying to do what we can. I am very concerned about parvo. I'm concerned about anemia and GI parasitism. Flea burdens can be so heavy that they can cause anemia in young animals because they're sucking so much blood. So these guys are in super rough shape. I'm staring over here because the puppies are in a cage over here. We've got several animals that we suspect are pregnant, so I'm going to be doing some ultrasounds to try to check and see how old those animals are. And it's kind of an all hands on deck situation today.
So we're over in the training barn right now, and today we are going to be concluding the horse training competition that we started over, I think about a month ago now. Caleb is going to be showing off what he's done with Galileo, and Haley is going to be showing off what she has done with Mercy.
I would say Galileo was just a bond. But she's a great horse, and she really likes to take off, and she's also like a teenager, so she likes doing things on her own.
Mercy has really improved on her people skills. Like, she respects people's boundaries now. She doesn't try to just push through you and get away from you. She actually stands when you walk up to her now.
So this is a competition. We're going to see who wins today. We actually have a couple surprises for both of them, but don't tell them.
We have had Haley and Caleb at our organization working with horses. It all comes down to today. They have been going over different ground manners. One horse is old enough to do riding, so we are very excited to see how this training challenge did and how well they've done, and we have some prizes for them. So we're going to be getting this going, but we are very excited.
All right, we got Caleb and Galileo coming up first. All right, Caleb, you got 10 minutes to show us what you've done with her, with groundwork and with riding. You ready? All right, go ahead and get started. You got 10 minutes right now.
Caleb, I'm pretty sure, is just getting Galeo to lunge in a circle and then just probably throwing some little obstacles at her and everything. But yeah, he's probably just gonna try to see if he can win with the whole riding her trick. But yeah, so Corey said that he's judging on how far the horse has come, not what the horse knows. So we'll see how this goes.
He's just getting the bit in the horse's mouth. He's about to put his helmet on. He's about to hop on and ride it around.
How many more minutes?
You got 4 minutes remaining. You got 1 more minute. Does she know how to pick her feet up? Go ahead and show us if she picks up her feet or not. 20 seconds left. Ten seconds. Time. So next up, we have Haley and Mercy. So you have 10 minutes to show us everything that you've done with Mercy. Appears Mercy is going as a ghost for Halloween this year. Time.
Let Corey do some deliberation and then we will go from there.
Wait, who won? Well, if you want to find out, click on this video to watch the full horse competition.